financement de notre système de soins de santé existe depuis le tout début. Dr. Evans nous rappelle que depuis 1975, les dépenses reliées à l'assurance maladie sont demeurées remarquablement stables, représentant 4,5 à 5 de notre produit intérieur brut. Mais si nous regardons les coûts des composantes de soins de santé privés à but lucratif, comme les médicaments, où l'augmentation est de 15 par année, on doit se questionner pourquoi il n'y a pas de débat sérieux sur cette question. Sondage après sondage nous répète les priorités des Canadiens n'ont pas changé beaucoup et encore aujourd'hui, Nanos Research nous confirme que la majorité des Canadiens et Canadiennes estiment que les soins de santé sont l'enjeu national le plus important et que 90% d'entre nous appuient les solutions publiques aux problèmes qui existent. Au nom de la Coalition canadienne de la santé, j'aimerais remercier Dr. Evans et Mr. Nanos pour leur temps et remercier votre attention. Et si vous avez des questions, nos conférenciers pourront les répondre. Do you have any questions for our speakers?
You're talking about the Canadian health system.
Yes.
How does Canada fit in the context of the world, other countries? Just to put it in a framework, at
Sure.
least a global framework.
Sure. Well, among high-income developed countries, Europe, South Pacific, Japan, Canada is a bit above the average of the OECD in terms of the share of national income devoted to healthcare. So it's a little on the high side, but not much. It has been higher, but it during the 90s converged back down towards the OECD average. In terms of the share spent, this is total healthcare. In terms of the share spent through the public sector, it's somewhat below average. It's in the low 70s, whereas the average would be closer to 80%. And the reason for that, of course, is that we cover, compare other countries on average, we cover less of the pharmaceutical bill and less of the dental bill through the public sector. I mean, each country has its own variations, but when you average all the numbers up, we're on the low side in terms of the public share. As compared with the United States, they're simply off the charts. They don't compare well with anybody, but they spend about twice as much per capita as we do, and about 50% higher share of their national income. On the low side, very much on the low side in terms of public expenditure. Although it is interesting that the Americans have a sort of a tax break for private insurance that all analysts are aware of, but almost none of the public. And the net result of that is that American health spending through either directly the public sector or indirectly through tax breaks actually works out to close to 60% of their total spending. So you think privately financed system, but in fact a large proportion of their total costs comes indirectly through government. But it comes in ways that give them little or no control over the total.
Is the new American system going to change? Does it change this?
The new American system will dramatically expand the number of people who have some form of insurance. It won't get to 100%. They're still going to fall short of that, but it will dramatically expand it. However, the concession that they've made for doing that is to expand the role of the private insurance sector. And the private insurance sector everywhere, but particularly in the United States, has very high overhead costs. So they will do this in a way that is singularly inefficient in the sense that a lot of the money will go to pushing paper rather than looking after patients. And they will face, I think, and I'm not the only one who thinks this, they will face some very serious problems now in trying to get their total costs under some kind of... basically, Obama, as part of the price of getting this thing through, completely ducked the whole question of how do you control your costs. That question will not go away. They know this perfectly well, and that will be the coming battle. Assuming that Obamacare manages to survive the next year or so, the next battles will revolve around how to modify it so as to get their cost escalation under some kind of control. But other countries have already gone through those battles, as we did back in the 1970s. They have to be continually fought. They don't disappear, but we have some of the mechanisms for doing it.
So if you give a brief report card of Canada's current situation, is that it's, well, how would you state that?
We do very well in terms of coverage and equity. I'd say better than average of the OECD countries, but they're all up there. They're better than average on that. In terms of value for money, probably not as good. We have not put as much effort into the evaluation of what we're getting for the money we spend as some of the other countries in I think the UK, I think, is among the leaders in this, but most of the countries in the OECD, well, I shouldn't say in the whole OECD world, there's a group of them that are surveyed by the American Commonwealth Fund, and the Commonwealth surveys show both Canada and the United States as being relatively backward in terms of trying to ensure that their system delivers value for money. But we're way ahead of the Americans in value for money when it comes to the payment process, because the most recent estimates, which are by about 93 now, if you update them for today's numbers, show the Americans spending somewhere around perhaps $4 billion a year on essentially bureaucratic waste motion. That's the amount of money that disappears into the private insurance system, and is spent on marketing and trying to decide who not to insure, and trying to impose rescissions on people who thought they were insured but found out they weren't actually once they had a problem, and all the kinds of things that private insurers have to do in order to make a profit. They don't do it because they're evil. They do it because that's what the private market requires them to do. But it creates enormous overheads that public systems don't have to carry.
Thank you very much for your time. Merci beaucoup.
Well done.
Yeah, we're all done.
Great.